Prescribing ChiroUp condition reports and release reports is the essential step for maximizing your return on investment from ChiroUp. Hi, this is Tim, and from my experience in private practice, I know what these reports can do. Number one, they improve patient understanding and patient compliance. Number two, they improve outcomes because patients who understand and are compliant tend to do better, especially when they're given best practice advice for the most essential exercises and ADLs. Third, these reports trigger outcome surveys because 30 days after you prescribe an initial report, the patient is sent a short 4-question survey so that you can then see what your outcomes and patient satisfaction are. And more importantly, patients who rate you as a 9 or 10 are automatically redirected to Google to rate you online. This is data, and this data is power. It's like knowing your batting average or ERA if you were trying out for a baseball team. And let's face it, whether we like it or not, we're all trying out for the healthcare team of the future, so knowing our stats is critical. The other nice thing that the reports do is that when you're generating a condition report, you can also generate an MD initial report, and later an MD release report. And these are the reports that summarize your care and let the MD know what happened and why you were the most competent person for the job. These reports change attitudes and change referral patterns. And the great news is, it's really simple to prescribe a report. We simply go into ChiroUp, we click on Prescribe Reports, we're going to drop in the patient's first name, our last name, we're going to create a new patient, we'll put in their first name, we would then drop in their email address, we'll save that patient, we're going to go to a region, let's say that this patient has a lateral epicondylopathy, and from that point we're done. I could scroll to the bottom and hit print or send an email or print an email, or we could save it for later. But all of the best practice advice is already populated for lateral epicondylopathy, the things that I'm going to do, the things that I want to tell the patient that I might otherwise forget, the exercises that are most essential, my care plan, and my goals. If I wanted to drop in a report for the patient's healthcare provider, that's pretty simple as well. It takes about 2 clicks. So we can modify any component of this process and deliver that information to your patient in seconds. The more efficient way to do that is having your staff do that. That a lot of offices, once they're comfortable with the protocols, they'll have their staff delegate this process. So the way that that's done is we can go into the forms library, we'll look up the prescription form, we'll pull up a condition report and exercise plan prescription pad. I keep these padded and in the treatment room, and when a patient has a new presentation, whether that be a new patient or an existing patient who has a new problem, we drop in their name, diagnosis, my care plan, treatment goals, who their MD was, shoot that off to the front desk, and they're able to drop that in. From that 2-second investment of creating a condition report, a lot of positive things happen. My patient is educated as far as the best practices. I'm able to collect outcome data. I'm able to collect Google reviews. I'm able to educate the patient's primary care physician, and I'm able to change the trajectory of my practice, and by working together, we can change the trajectory of our profession. I hope this information helps. I hope that you'll consider prescribing reports starting right away for every new presentation, and I look forward to working with you for many years in the future. Thanks for watching.